want to talk to you about relationships, how to talk about hormonal issues. And when I was thinking about what to say in this next half hour, lots has come to my mind. So again, it's going to be a bit of a brain dump, but actually I've had lots of questions and comments, and some of them are really sad actually, because the recurring theme through a lot of messages that I get is that it's so difficult to be listened to. So before I talk exclusively about relationships and how to talk to others, whether it's friends, relatives, work colleagues, I just thought I would just start a bit more at the basics, actually thinking about again what menopause is, because menopause has always been a bit of a butt of jokes. You know, don't go near her, she's menopausal. Oh, it's all hormonal, ha ha. And we've known this for decades, centuries, that women have just been told to just put up, shut up, get on with it, that's your lot. And this is happening quite a lot in menopause, actually. I was reading some comments earlier today by a doctor saying that it's outrageous that women think that so many of their symptoms are now due to the menopause. Actually, I don't think it is. I think we've been told for many years that the menopause is about periods stopping, it's about flushes and sweats, maybe low mood and some vaginal dryness, and maybe reduced libido. And as many of you will know, I've spoken at length before, and I will continue to speak, that I feel we need to reframe menopause, talk about what it is, because for two reasons. Firstly, when you just talk about it being a year after your last period, many people think it's just a day in our life, which of course officially menopause is, but after that time we've still got low hormones. But if we only talk about menopause, we're excluding millions of women who have hormonal deficiencies that are affecting the quality of their life and their symptoms as well. And that is really, really important. And so we have to think about perimenopause, the time when we're still having periods, but our hormone levels are fluctuating and declining. But we also have to think about premenstrual syndrome, PMDD, premenstrual dysphoric disorder, and actually postnatal depression, and actually any hormonal changes that can affect our either physical or mental health. And then we encompass it, and we should be then talking about hormones. So I think we should be using the word menopause less and talking about hormones more, because as you know, hormones are chemical messengers. They go in our body, they affect every single cell in our system, and they do have important effects. So changing just the language of what we use when we're explaining what's happening to us, I think is really important, because we all together as women have got the opportunity to educate as many people as possible. But talking about hormones rather than menopause, I think is something that we should be doing more and more as we progress in this conversation, to allow more women to know what's going on with their bodies, to talk to others about what's going on with their bodies, and more importantly, getting the right advice, support and treatment that they want as individual people. So talking about a hormonal problem then opens up that conversation very quickly. Now, I've got three teenage, well, they're not now, one of them's 21, so I've got two teenage daughters and one who has been a teenager. And so obviously they've had and still do have times of change with their hormones. And so with this conversation, it's not just my hormones affecting them, it's how their hormones affect me, but also the whole family as well, and their friends and colleagues and other family members, etc., etc. And that's why I thought when I'm talking today, I want to be talking about hormones. And then actually we can still include men in the conversation too, because men have hormones. A lot of men have low testosterone as they get older. And actually it's not a bad thing that we start talking more about how hormonal changes can affect men too, because some of them need to be included in the conversation, because they might be suffering and don't know how to talk. So the first thing really is thinking, when we think about how hormonal changes affect us, we think about symptoms. And that's fine. And I'm hesitating though, because actually for some people they might get minimal symptoms, or they might not get symptoms that they recognise as being related to their hormones, or there might be some cultural sort of beliefs that we shouldn't be talking about symptoms. So again, part of reframing what menopause is, we need to be thinking of this hormonal insufficiency or deficiency that has health risks. We need to be thinking of it as it's so important we receive the right help, advice, support and treatment to improve our future health. So when we talk about it as a hormonal problem with health risks, then we can include the concerns about our future health, because then that's really important, because we're living longer, we're got more risk of diseases the older we are, and a lot of those diseases increase without hormones. So a lot of people recently, especially this week actually, have been asking me how we reach populations where culturally that people don't talk about menopause. We just it's not a word that's used. In fact, a lot of languages don't have the word menopause, and it's almost a shame to admit that you have symptoms. But if then you talk about actually ignoring these hormonal changes and not getting the right treatment, means there's an increased risk of diseases, especially heart disease, dementia, and diabetes, then it changes the narrative of the conversation, changing it from something that's just a butt of jokes, she's a bit hormonal, to actually thinking, oh my goodness, actually, if this person gets the right help, advice and treatment earlier, she'll be healthier for longer. And that's another thing that's really important that we think about. So it shouldn't be just, are you having really bad symptoms? Are they so bad that you need help and treatment? No, if you're getting any symptoms that are affecting your quality of life, or you think that you've got hormonal changes and you want to talk to someone, you shouldn't wait too long. Or you shouldn't wait too long to talk to people how these symptoms are affecting you. So when I started doing menopause work exclusively, about 9 years ago now, I started to look at all the symptoms, and then a lot of symptom questionnaires, they still are actually quite short. And I remember showing it to my husband, who now, by the way, has learnt a lot about hormonal changes, but at the time, he looked at all these symptoms and said, but most women have those symptoms. And I could have throttled him. I could have throttled him as well, because I was perimenopausal at the time, but didn't recognise it. But actually, you're right. That's what makes it really difficult for us as clinicians to diagnose women, because a lot of symptoms we will have due to different reasons, not just our hormones. So I printed off the Balanced Menopause Symptom Questionnaire. Now this is a validated symptom questionnaire that somebody wrote in the 70s. So in the 1970s, this Dr. Green decided to validate this questionnaire based on the women that he saw in his clinic. It's now 2024 and there isn't a new questionnaire, so we are designing one, and actually I'm going to put it out soon and ask some of you what you think about the questionnaire, whether you think it's got the right symptoms. And they're the symptoms that I have recognised from speaking and treating thousands of women over the last decade or so. But at the moment, this is what we've got. So this is useful to print off. And actually what it does is it has columns saying not at all for all the symptoms, not at all, little, quite a bit, or extremely. And then you can work through it. And this is something that's on the free Balance app. And people should actually monitor this every 3 months at least, even more regularly if you feel you're experiencing symptoms. Because things, if you take in isolation, like feeling tired or lacking in energy, well, most of us feel that at some stage. How do we know if it's hormonal or not? Or irritability. Quite often I feel a bit irritable, but it doesn't mean it's my hormones. It's just because I'm a bit tired and I need to unload the dishwasher and I want to make a cup of tea and I've got loads of work to do, so I get irritable. That's quite normal. So how do we decide? So that's why the collection of symptoms is useful. And then really reflecting and thinking, how much are they affecting you? And have these symptoms crept up without having any change? So if you're irritable for no reason whatsoever, which I certainly was when I was perimenopausal, then you need to be thinking, could it be related to my hormones? But not only is this good for you, I think it's a really good thing for others as well. So actually speaking to someone who's very close to you, whether it's your partner or a friend or colleague at work even, and saying, do you know what, these are the symptoms that I'm really struggling with, and I don't quite know how to get help, or I don't really know how to talk to you about it, but I just wondered if I could show you, just so that it will highlight how I'm struggling at the minute, or which symptoms are the ones that are difficult. And especially when we talk about mental health symptoms, you know, it's so much easier. If I had a big rash on my face, I could point it, I could show you and say, look, this is really sore. But if I'm feeling really joyless and flat and quite emotional and anxious, it's so much harder to talk about it. And that's why actually having something that something that you've got to show can often be a lot easier. So that's something that I think is really useful, and it helps educate others. Or you might be listening to this because you want to help a friend, a colleague, or a relative. So give it to them or fill it out together and just see if you know, which of the symptoms are really affecting, and also then take it to your healthcare professional and say, look, these are my symptoms, this is what's happening, I think it's related to my hormones, can we just talk about the right treatment for me? So that's a really useful starting point. Then the other thing in my book, actually, I have written a lot about, it starts on page 80. So I've written a section about talking to your mother or other female relatives about menopause. And actually this is really important, and I'm very lucky because I had Julia Samuel, the wonderful psychotherapist, to write a part about this as well. And she wrote about being open and honest, really important actually, and really thinking about how to talk about menopause with children, and think about your own coping mechanisms as well. And also I've written about why it's important to talk about menopause, but it's not just menopause, perimenopause, hormonal changes as well. And I think why it's so important is because if you're a close family, I'm certainly very close and open with my children and my husband, but they really sense if something's not right. They really sense if I'm in a bad mood, or if I'm feeling emotional, or if I'm feeling tired. And they actually sense it more when it's me, when rather than if it's my husband. And this is quite a generalisation, but if he's in a bad mood, he doesn't often get in one, he'll just go into watch telly, or he'll just go into his study and do some work. But actually people don't really notice as much. Whereas I suppose I'm often cooking, or collecting the children, or talking to them a bit more maybe, and it is more apparent if I'm slamming down the cutlery as I'm laying the table, or if I'm just feeling more angry than normal. And it has an impact, you know, it has a really big impact on children. They look at us as role models if we've got children, and so we should be explaining that actually something's not quite right. I think it might be my hormones and I'm going to talk to someone about it, but you know, just explain that it's not something that you're always going to feel like, because it can be quite frightening for people when they see this change. But the other thing is using your children and asking them, have they noticed a difference? Do you feel that I'm different to how I used to be? Because they're really transparent and honest, or most children are. And actually, some of you might know, it was my middle daughter who diagnosed my perimenopause, because I was struggling for a while and hadn't realised, and it was just one day she said to me, "You are so irritable. Do you think you might need your period?" Because some of my friends, their mood improves when they have their period. And honestly, I felt so sad when she told me, because then I realised the penny dropped, and I realised that so many of my symptoms had been due to my changing hormone levels, and I hadn't had a period for several months. But I'd not monitored my symptoms, I'd not monitored my periods. So for her to actually say that and have really good observation skills, age 12, that she saw in her friends and tried to reflect it into me, was actually really important. And it meant that I only suffered for symptoms for about 5 months, whereas so many women I speak to, it's been 5 years or decades. And that's what's really sad, because none of us should really be suffering if we can receive the right support and treatment. So actually saying to people, even before you might get symptoms, actually we're all going to be menopausal, we're all going to have hormonal changes, and it will affect people in different ways, but perhaps read this bit, read how it can affect people. And if you notice that I'm changing, especially with my mental health, just talk to me about it, because it's just easier to be pre-warned as well. And then it's choosing the words. If you want to talk to somebody who you think might be hormonal, it can be really difficult, because many of us get very short-tempered or very emotional. So if someone then just says, "Oh, is it your hormones?" you might become more emotional. But actually just sort of reflecting and trying to help that person rather than just blaming the hormones. So saying, "I've printed off this questionnaire, I wondered whether you wanted to go through it together, or have you read this book, or have you listened to a podcast, because I'm just wondering whether some of the difficulties you're having could be related to your hormones. I don't know, I'm not an expert, but maybe we could look and work out together and learn together." And that's really important, because a lot of people, when their hormones are changing, feel very isolated, they feel very alone. So to work with others can be really useful. And many people have got friends of similar ages, they might be experiencing similar or different symptoms as well. So just getting it out in the open, I think is crucially important. And we know for generations people haven't spoken about their own experience to their children. And so many people will have grown up thinking that their mother, their auntie, didn't have any symptoms at all. But actually, in reflection, a lot of people say, yeah, I do remember my mother going in the garden and screaming, or just being really tired, going to bed a lot more at the weekends or what have you. But there's no shame. Just because they didn't talk about it didn't mean they weren't experiencing symptoms. But it is worth trying to talk to your family members if they want to talk. They might not want to. And certainly the questionnaire that I did before the book, where we asked 6,000 people, we found that 75% of women had never spoken about menopause at home, and a third have never spoken to their mother about it, which is a shame, really. The other thing, if we think about the 1 in 30 women under the age of 40 who have an early menopause at a younger age, sometimes the early menopause at a young age can run in families. So if you have family members who have become menopausal at a young age, then it is worth thinking about yourself if you're young and working out, could it happen to me? There's no test to know, but if you've got cousins, sisters, aunties, mother who had a menopause at a younger age, it might happen to you as well. So again, be on alert, think about having whether you have any symptoms, whether there is anything to help you make that diagnosis earlier, because we know lots of young women are struggling for many years before they get the diagnosis, and often it's a combination of the doctor not recognising it, but also the patient themselves. So it's worth just asking around to your family members. But how a family member experienced menopause is not going to be the same as you. A lot of people think, oh, if you know, my mother had awful night sweats, I'm going to have them too. It doesn't always follow. There's not really good research in how symptoms can run through families, but we shouldn't be hoodwinked and thinking, oh, just because my mother got XYZ symptom, it means that I'm going to get the same, because it doesn't work like that at all. But talking about it is really crucial. We know also the impact of menopause in the workplace. A lot of women, far too many, are struggling with their jobs. They're struggling to keep full-time employment. They're struggling to keep their job, and many are not going for a promotion. And sadly, around 10% are actually giving up their job due to their symptoms. But the symptoms are usually, when you look at surveys, it's actually most commonly memory problems, anxiety, fatigue. So actually talking to your boss about, can I wear a different uniform, isn't really going to help a lot of women. So again, that's where education in organisations is really important, so people know what the symptoms are. If they're going to occupational health and being signed off for anxiety and depression, is it really, or could it be related to hormones? If people have PMS or PMDD, it might be the beginning, first 3 days of every month, they're really struggling to work. And if there's a pattern to that sickness record, or just inability to work as well, then it should be sending signals to think, could there be a hormonal component? Getting more people educated, and then signposting them so that they can get the right information, and more crucially the right treatment. Because we know if women have treatment, they're less likely to have symptoms, they're more likely to be able to function at work as well. So it is in the employer's interest to actually provide really good menopause support, and also access to medical treatment as well, because after all, the best treatment for any hormonal issue is replacing the missing hormones. And we have very safe hormones available that just replace the missing hormones. So educating everyone in the workplace. The other thing that's really important is spinning it on its head. I've spoken for the last 15 minutes or so what it's like for you and how to talk about it to others. But actually, what's it like for partners? What's it like for partners who are experiencing their loved one, the person that they've known maybe for 20, 30 years, suddenly not being themselves, suddenly just being a shell of themselves, not being able to sleep, even if you're sharing a bedroom and the duvet is on or off, or there's a fan, or the windows are open, or they're up in the night crying, or they're going to the toilet 10 times a night. How does that disrupt your sleep? How does that make you feel? Do you feel angry, or do you feel sad that you've lost that close relationship with your partner? Are they talking about how they're feeling? Do they not have the energy to go out for a walk in the evening? Or you go home and you realise they've just been sitting on the sofa all day and the house is all messy and the supper hasn't been made, or what have you. This is a generalisation, but we often find that people find that their energy is so low that they don't do the same, that they don't want any, or they're not really bothered as much with the relationship with their partner. So the partner then internalises and thinks, well, what is it? Is it my fault? What have I done? And don't always realise it's related to hormones. And that is really important. And then the other thing to think about is the intimate side of a relationship. And I've spoken about this before. A lot of people find that their libido reduces, their sexual desire reduces. A lot of people say to me they just feel numb from the waist downwards. They have no pleasure. Even when they have sex, they just go through the motions. They find it very difficult to orgasm. They're not enjoying it. They might have vaginal dryness, soreness. So then it's very unpleasant actually having sex. And so many people tell me they just don't talk to their partner about it because they feel ashamed, they feel alone, and that's really sad. And for a lot of partners, they know sex isn't the same, but they don't know how to talk about it either. Or they think it's them, they think their partner doesn't fancy them or love them anymore. And a lot of women say to me, I really love my partner, I don't want them to leave me, but any intimacy has just gone in our relationship, and that feels really sad. So talking about it is crucially important, and allowing the partners to know that it is a very common symptom, but it can often improve actually, certainly when hormones are rebalanced, thinking about systemic hormones, thinking about vaginal hormones, thinking about the balance of estradiol, progesterone and testosterone often as well. But talking about it so it doesn't become a thing between people as well. So being honest about how you feel is really, really important. And as a partner or a best friend, you might feel that your friend or your partner isn't the same, or not going out anymore, not accepting invitations, or not staying for a drink after work. Then we should be thinking what's going on, and could any of it be related to hormones? And so that's why education for everyone is so crucially important. And we don't need to wait until someone's actually menopausal. So long or so often people say to me, oh, well, she can't be menopausal because I know she's still having her periods. No, of course she was not menopausal, but she's having hormonal changes, and we need to pick those up earlier. And then the other thing is thinking about, I've already mentioned having teenage children. So if you've got teenage children, boys or girls, who are having hormonal changes, and you're having hormonal changes, it can really clash in the household. And so actually explaining to your teenagers how hormonal changes have affected you, if they are affecting you, but also how it can affect them. And actually it can be really frightening for teenagers when they suddenly have this spontaneous crying, or they feel really irritable, they feel really cross, and they don't understand what's going on. And the last thing they want is a mother to just laugh it off or shrug it off and say, oh, it's just your hormones. Actually explaining that the hormones occur throughout the body, they're really important, the brain's producing them, but there are changes as they're developing, and the changes can occur at any time, especially in girls. Often our hormones drop before the periods, and that's often when people can feel worse. And so often explaining to people that their mood is likely to improve when they have their periods. Sitting down, talking about how the menstrual cycle can change, and how the periods can change with the menstrual cycle as well. And then thinking about treatment sometimes for young people, because it's really important they're not neglected. So many people are just put on the pill because it will stabilise hormones. And we see that a lot in teenagers, and we see it actually a lot in perimenopause as well. And I've spoken before, and it's on my YouTube, looking at hormones for contraception, and they're not the same as the natural hormones, and we need to be really clear. So if people are having contraception that's smoothing out their hormones, it might actually be negating the positive parts of the hormones as well. So as you know, if someone has a contraceptive pill, it will block testosterone, it will be a synthetic estrogen and progesterone, so it won't allow the natural hormones to work. Some people find that they feel a lot better on them, but some people find that their mood can dip, they can feel worse. And so looking at the impact of hormones in our brain when people are younger is really important, and not just thinking, oh, we just need to give them contraception, because it might be the right thing, but it might not be the right thing giving a certain hormonal treatment, especially if people feel worse on it. And a lot of teenagers understandably don't want to talk to their parents about contraception, and that's fair enough. They're allowed to choose about contraception, but I do feel very strongly as a mother we should be giving them advice about hormonal contraceptives, the pros and the cons and the choices, so then they can choose themselves. And certainly if they get side effects or problems with one, they know that there are others, and they know who to go and see and how to get confidential, impartial advice and treatment from the right person. And that's really important. And I do feel as an older woman that we should be educating younger people as well. And the other thing actually is also is allowing our children to have the confidence to talk and help others. Some of you might have listened to the podcast I did with Jess, my 21-year-old daughter, who was 20 when we did the podcast together. And she talks a lot about how she talks to older people when she comes across them. It might be that she's just heard a conversation in the toilet, or it might be someone that she's been taught by, or someone who's a colleague where she works. And she can see that they've got hormonal issues. And if the conversation comes up, she can be really outspoken and very unashamed talking about hormones. And I think using the younger generation to educate us who might be a bit more hesitant, we might be a bit more apprehensive, especially if we're talking about the impact on our mental health or even on sexual desire. Younger people are great because they say it as it is. So if we can educate them, not only will they know about their own hormones as they get older, but I think they'll be able to start conversations in other generations. And certainly in some areas and cultures, actually the granddaughter-grandmother relationship can be closer than the mother-grandmother relationship. So actually we can use our younger generations to educate other generations as well. And that's really crucially important. It shouldn't always be the onus on the person who's experiencing the symptoms. We can now allow others around us to help. And that's really crucial. No one should be doing this alone. I've spent a lot of time, effort, resources trying to educate as many people as possible for free in an evidence-based way, but hopefully in a way that then people feel supported. And I've got lots more plans to try and build a better community so we can all help each other and share with each other what's worked and what hasn't worked. And if we haven't been listened to, how we can change our language or how we can change our approach so we are listened to, so that we can then move forwards. Because, as many of you know, the menopause and perimenopause should be a really positive time in our lives. And it's crucial we get it right, because so many people will have low hormones for decades. Some women, when they're young, if they have an early menopause, will have low hormones for longer than they've had hormones. And that's why we need to be making decisions and we need to be in control of our future. And that's why having as much information as possible can help guide us to the right treatment that's right for us. And looking at a combination of treatments, not just thinking of one treatment, but thinking very holistically and making the right decisions about exercise, about nutrition, about well-being, and involving our family members as well. Because if I do yoga with my children, I love it. It makes me feel really good. And so that's a really inclusive thing. Talking is so important, and not keeping it bottled up, but talking to the right person. And it might be a few people that you have to go through. And also, if you know someone that's struggling, you might want to talk to others around to see how they've dealt with it, how they've helped support that person. So there's quite a lot of information in what I said. I've tried to keep it as general as possible because everyone's got their own story, whether it's a personal story or they're trying to help others. But what we are trying to do globally is to really help as many people as possible. So I'm very grateful for your support. I know I can't answer individual questions, which may be a bit frustrating, but I try and keep it as general as possible. And all my Instagram lives get uploaded to my YouTube, so you can watch them in your leisure, and give me some ideas for future Instagram lives as well. So have a good week. I hope you enjoy the rest of the evening, and I hope that's been useful for people to just think about how we can continue the conversation in hopefully a more positive way as well. So thank you for your support.